the procedure for a laceration?
We've talked the whole night.
Good morning, everyone.
Good morning to you. Good morning, good morning. It's great to stay up late. Good morning.
Morning.
Good morning. How are you?
I'm pretty good. How are you?
I'm good. I have a note for you. Someone phoned this morning.
Oh, okay. Thank you. Yeah.
I have a lot of work to do. I can't let this affect it.
Oh, hello. Come on in.
Hello.
Michelle?
Yeah, I'm Michelle. Nice to meet you.
Jack Niepon. How are you?
Good thing.
You can call me Dr. Niepon. Come on in. So, this is a typical family practices offices. I've been here for 30 years. So, follow me. Come this way. Is that a camera? Okay, so this way you can see, these are the charts that I will be seeing tomorrow, which is Monday. And there's probably about 55 to 60 here.
Busy day.
So that's my Monday. Busy.
Are you the only doctor in here?
I'm the only doctor here. I used to have 2 or 3 partners. They've moved to the States. And since they moved, it's hard to find family doctors. As a matter of fact, if you try to find a family doctor, you won't find one. Very difficult.
Really?
This is another examining room. I use this for psychiatric or psychotherapy. I used to use it for examinations, but not anymore. This is sort of like the quiet area, where I might speak to someone for half an hour about emotional issues. I come through the back door in the morning, sit right there. I'll show you my my office. My office is over here. A large collection of books and a lot of charts, which I still have to work on.
So the people that you've seen recently?
In the last 3 weeks, yeah. These are like insurance forms, workman's compensation forms, tax credit forms, welfare forms, and so on and so on.
Is it okay to say that you're here on a Sunday doing paperwork?
I'm here on, quite often I'll come in once a weekend, on a Saturday or Sunday for 4 hours of paperwork, as I was today.
Okay, so when you were in med school, what type of psychological skills would they teach you, or like that you could use to cope?
We were taught no coping skills.
Really?
No stress management, no skills at all in terms of coping with the pressure of medicine, which is huge. 0 lectures, not 1 hour, not 1/2 hour, nothing.
Wow. Why do you think that is?
Well, I think that the doctors that trained me were trained the same way. There was a lot of yelling and screaming by doctors on residents when I was in 2nd or 3rd year medicine. If I made a mistake, or when I was learning clinical skills, how to listen to the heart, how to take a blood pressure if I didn't do it right. There were some people that would get mad, angry, call names. That's how they learned it that way. They learned to be bullies.
Right. Was that discouraging to you at all that way?
It was frustrating, but I understood that that's what they went through, and
Right.
I was already warned by students a year or 2 years ahead of me that expect it to be pretty tough. And I think with second year medicine, we did a lot of clinical skills.
Right.
Learning to listen to the chest, look at the ears, nose, throat, examine the abdomen, neurological system. It was, there were some older surgeons especially that when they were teaching us, if you didn't hear them the first time, you would be yelled at.
You get it here. Yeah.
I even got hit in the back of the head once.
Really? Okay. And like, can you just quickly describe the team you work with in your office on a daily basis and what kind of relationship you have with them? Like your secretary, is it strictly business, or do you ever see them outside of your work, or?
We have a very low-key atmosphere here. I've known two of my secretaries for 30 years since I started here, and they're both 74, and they both are perfect for the practice. They know the patients as well as I do. You're only as good as the people who meet the patients at the front door, because they make or break a practice. If they're rude or get into arguments or can't handle difficult patients, it makes it difficult for me.
Right.
But since they're so experienced, which is rare, we get along well. It's not really a business atmosphere. They call me by my first name, which is totally acceptable. We do go for lunches. I take them out on holidays. And my other secretary, who's been here for 7 years, the same relationship is it's very open and honest. If they have a problem, they know they can talk to me about it as soon as possible.
Okay.
I don't like to wait. We like to deal with it right at the time.
Right. No, that's great. Okay. Well, thank you very much for answering our question. That was
You're
great.
very welcome.
And
Okay.
thanks for taking us on a
Yeah.
tour.
Thanks for the tour.
Thank you.
Awesome. Thank
Yeah,
you.
thanks a lot.
Anytime.
All right.
That was good.
Yeah.
What kind of coping skills have you heard of, like doctors using? Have you heard of alcoholics doctors or?
12% of the medical practice worldwide is alcoholic or addicts. Most doctors tend to, because of the access to drugs, tend to use medications, narcotics, sedatives like Valium, rather